All right. Well, thank you so much for joining us today. I have Dr. David Ginsberg here. Thanks so much for giving us your time.
No problem. Great to be here.
We're going to share just a little bit, I think, story. I think your background is interesting. I think it's worth sharing. And your journey through the fellowship program, even though you finished in the fall, because of scheduling, we can finally get you to a conference and give you your sesh. So, David, what got you into chiropractic? Like, why this profession?
Growing up in high school, I was my doubles partner and I tennis.
Okay.
We were one of the top teams in the state of Illinois, and I developed sciatica
Okay.
as a junior. And I knew my medical doctor was going to be like, "We'll just take off a month." And I was like, "No way, I'm doing that." And my oldest sister's a chiro.
Okay.
She was in chiropractic college. She's like, "You need to go see a chiropractor." So she found me somebody. He explained, how it works, that I had subluxations, I have nerve pressure, it's from my back. I just need to do some adjustments. And I was like, shit, this is awesome. I already wanted to do something in medicine, but I didn't really want to be like a family doctor or prescribe drugs. And so I thought, what a cool way to help people with my hands. I can help them live healthy lifestyles, do their sports and stuff like that. And so, yeah, the rest is kind of history after that.
Yeah, well, no, that's, I love the story of the experience, right? Because
Yeah.
sometimes, and I think sometimes nowadays we see, chiropractic at the level that it's being recognized, people do go into it because of the professional opportunity that it gives. But the core always seems to be that kind of experience. Now, how long ago was that? How long have you been in chiro?
This is my 33rd year in practice.
33rd
Yeah.
year. Okay.
Yeah.
So you've definitely seen chiropractic morph, change. Do you know, like, have there been any differences for you throughout your experience, generally speaking, that are different than when you started? I mean, 33 years ago, chiropractic was a little different, right?
Yeah, I mean, I guess you could say there's a lot of changes, and I've almost seen them twice. When I practiced in California right out of school, I
Mm.
felt like the practitioners I worked with, my mentors, they were into research. They owned a physical therapy clinic. They had a network of medical doctors that they
Mm.
worked with. So I was already kind of exposed to this is the future of chiropractic. And then after 5 years, I moved back to Illinois, and it was like trying to introduce myself to
Mm.
medical doctors like neurologists. Yeah, no, chiropractic, that's just BS.
Mm.
You can't help people with migraines. Orthopedic doctors after surgery didn't even refer to physical therapists in my area at the time. So,
Vastly different.
so vastly different. And obviously now, in especially with the fellowship program, starting to develop relationships with the medical community, there's much more openness, and
Mm.
especially the younger the doctor, they don't have that chiropractic is voodoo sort of mindset. But I would say my area is still very, very conservative, slower
Yeah,
to
and
change.
yeah, and that's interesting. And in terms of that change, though, regardless of the geographic region, we obviously know that change is occurring. Why do you think that is? In terms of perception of chiropractic, what's your feeling, right? Like on who's opening up? Is it us? Is it them? Is it a little bit of both?
Uh, I would say it's probably patient driven. I mean,
Mm.
we've been around for so long. I don't think you can ignore the results for that long. Doctors hearing that their patients are getting better doing this, even though they don't know what we do. It's kind of like, well, if it works for you, fine. That's sort of
Right, right.
the attitude of the GPs and even some of the orthos. Like, I don't refer to specific people, but if it's working for the patient, then I say fine. If it sounds weird, I say don't. Obviously, research has
Mm.
backed what we're doing and is starting to explain why chiropractic works. So I think those two things together probably have posited the changes that we're seeing,
Okay,
and
and
the
that makes sense.
acceptance, I guess. Yeah, that's my opinion.
No, but I think that's a great observation because I think of your tenure in the profession. You've been around long enough to kind of see that, and I think what's interesting to me when you were talking through that was that it comes from different angles, right? There's not one switch, right? This is sort of a process, which very interestingly, 31 years into practice, right, ish, you decided to, hey, I'm going to take this chance on this fellowship thing, right? Can you tell us a little bit about what was that? This why do that? Like you could have sat in your practice, been comfortable, blocked out the world, and just put the blinders on, but you didn't.
Yeah, I guess at the core, I guess I'm always wanting to learn and better myself. I started with some of your courses.
Mm,
They were interesting. I loved the perception. And I think what struck me the most was that you're getting referrals from medical doctors. And in my mind, I've had great mentors and great teachers. I'm closer to the end of my career than the beginning, and I want to give back, and
mm,
I'm looking for opportunities to do that. Some of the ways I thought I could help in my area haven't really worked out because the chiropractic college isn't really kind of down with the way that I practice, I guess, so to speak, and how
okay.
I'd want to help. So the fellowship I look at as like, okay, I can better myself. And what's really helped me learn is to communicate to the medical profession using their lingo,
Mm,
and
okay.
so then they understand that, and then I think that helps to develop trust. And what I guess I'd like to do is make it easier for younger doctors coming out of
Okay.
school to set up a practice and be established and not have to struggle. And I also would like to advance our profession as far as credibility, like,
Mm.
hey, we're not just a bunch of schmoes. Like we actually in many ways know and can relate to patients a lot better than most of the medical practitioners out there, and we are educated. It's not just the art part, it's the science too. And I think for the fellowship trained doctors, they seem to put that all together. And
Yeah, no, and I think, what struck me, which I think was really interesting, was how you talked about, your interest and sort of maybe I don't want to use the term conflict, but the difference between the way that you practice and the way that a chiropractic college would want you to teach, right? And I think that's a really great example of the difference between chiropractic education and graduate, right? There's a second tier, just like in medicine. And I think you've been around long enough to say, not that perhaps maybe the chiropractic side, the 4 years is just vanilla, and the difference gets made in the graduate. And I think that, well, for me personally, that was the reason for the fellowship, is to not change the structure of chiropractic academia, but to add to it.
sure.
Right. And
Yeah.
you went through a series of rotations, and in the last couple minutes here, can you just maybe highlight one experience or something that, you did rotate with another medical professional, and there's some things in there that you were like, wow, this is something I'm going to take with me for my whole life. Right. It was kind of the aha like thing.
Yeah, the probably the ortho, well, the neuro spine, which the surgery that I watched was like 2 level fusion, 1 level discectomy, and it was done with a neuro and an ortho surgeon, and these two always work together. They've been practicing a long time, and so the ortho guy does the instrumentation, and the neuro guy does the more fine kind of cleanup. But what I took from that was just really how much they have to know and in
Mm,
their craft and their ability to be a good surgeon, in my opinion, is very similar to a chiropractor being a good adjuster and being a good diagnostician of subluxations. And then at the same token, if you step back, they also have to be good diagnosticians to determine, should I be doing surgery on this patient or not?
mm,
The
mhm.
same way a chiropractor has to decide, should I be adjusting? Should I be doing traction? Should I be referring this person also to a medical doctor for whatever reason in the right place? You have to wear a lot of hats.
Mhm.
And so I guess I saw the similarities in that. And it gave me a greater appreciation for, like, wow, this is pretty intricate what these guys are doing.
No, and it's there's a lot of you're impressed with it, right? Because it is impressive. But what's interesting, I've had conversations with chiropractors my whole career, and you know the misconception was that hanging around with MDs was going to make me more like them, and I found the opposite to be true. The more that I hang out with MDs, the more I become chiropractic centric. Did you find that with your rotations and your ability to talk with them, that was true as well?
In some ways, yes. I guess for the folks that I get along with best,
Sure.
for sure. Because I think maybe because that's those those medical doctors seem to have a very similar philosophy that we do. That we're going to be managing these people, and that it should start way before they even get in our offices and teaching them, to educate them on exercise and taking care of their bodies
Sure.
and not waiting till everything breaks down before you just rely on chiro and then surgeon.
Yeah, and I think that ultimately that's where those philosophies meld, because fortunately or unfortunately, the spine care patient needs both sides.
Yeah.
You need those minds. So I appreciate your time. We've had a great conference so far, and thanks for sharing your story. I think it's inspirational. I think, and I hope that a lot of other people get to hear it, and maybe that motivates them to be a little bit better as well.
Well, thank you, Bill, for just for starting the program. And I don't know when you sleep, all the stuff that you do, but I really appreciate it. And yeah, it's been a great experience. Thank you.
Wonderful.
Yep.
Have a great day.